Lessons from a tragedy in a neighboring state. The head trauma surgeon in Las Vegas the night of the massacre is now in southern Arizona, and he's educating doctors, nurses, and first responders on how to prepare for traumatic events.
News 4 Tucson's Eric Fink spoke with the physician. It's new at 10.
It is the deadliest mass shooting in U.S. history. 58 people died, more than 500 people were hurt when a lone gunman in a high-rise hotel room opened fire on a crowd at a country music festival. The doctor on call that Sunday night in Las Vegas says dozens of patients came into the OR in a matter of minutes. 10 months later, these pictures are no easier to digest. Las Vegas trauma surgeon Deborah Cools was finishing her shift as the shooting unfolded just minutes away from her hospital.
We saw 104 patients. I was on call that night, and I took the role of the senior surgeon to help decide who needed to go to the operating room, who needed blood.
Cools is the keynote speaker at the 29th Annual Southern Arizona Trauma Conference. She remembers vividly how quickly her OR filled up with critically wounded patients.
We went really from 0 to 40 patients in about 5 minutes. Unless one plans for disaster and practices, one won't know what to do in the heat of the moment because it happens so fast.
Just outside the conference, Arizona doctors and first responders watch as a Black Hawk helicopter performs a simulated level 1 trauma rescue on the Star Pass golf course. Cools and her colleague at Banner, Dr. Andrew Tang, stressing the need for effective communication in such a fluid situation.
Our hospital knows that there is a disaster plan. We may not be in perfect communication with what the various agencies that we work with in the pre-hospital setting in terms of how can we make that smooth transition from scene to hospital.
And if we train, we'll do a good job, and as many people as possible will survive and recover.
On the west side, I'm Eric Fink, News 4 Tucson.
The man